Welcome to Inventive Minds Child, Youth, and Family Support Center. We are a not-for-profit organization working with families in their day-to-day parenting by providing workshops and seminars related to pediatric and child development. Inventive Minds provides care in the early years sectors for newborn to age 6, licensed under the Ministry of Education all across Ontario. Inventive Minds carries an elementary school open to international students from junior kindergarten to grade 3. The Inventive Minds Family Center helps families in mediation, arbitration, and parent coordination cases related to family separation and divorce. We support families during and past separation and divorce. Inventive Minds works with court orders to conduct child voice report and parenting courses related to CAS, court, and mediation purposes. To learn more about our services, reach us at inventivekids.com. My name is Rose, the founder of Inventive Minds Family Center.
Today's workshop topic is about breastfeeding, how to maximize your milk production, and tell if your baby is getting enough milk. Today we have with us Nicole Schwartz. Nicole is a licensed and registered international board-certified lactation consultant and holds an undergraduate degree in biology. She has always had an interest in the human body and how it works. From a young age, she always envisioned herself working with children. So Nicole, great to have you here.
Thank you.
Please tell us, if you could, some of the basics we should all know about milk production, and also a bit about the topics that we'll be discussing as well.
Okay, today we're going to talk about how to maximize your milk production, talk about a little bit about milk production, how it even works.
Sure.
And then talk about signs that your baby is getting enough milk, and then what to do if you're concerned your baby's not getting enough milk, and also if you're concerned about how much milk you're making.
Cool.
So when you are pregnant, around 16 weeks, your body actually starts making milk. The hormones in play during your pregnancy keep you from making large amounts of milk. Right after you have your baby, milk production is under the control of your hormones. So that's called your endocrine system. Whether you breastfeed or not, you're going to have milk. After a couple days postpartum, if you don't start removing the milk, your body's going to start getting the signal, okay, I don't have to feed a baby, so we're going to kind of stop. It starts to turn into autocrine control, which means outside of your body. Hormones still play a role in your milk production, but it's not the driving factor anymore at that point. So your baby becomes the driving factor, or your breast pump. So you're removing milk, and that's telling your body to make more milk.
Got you. Are there scenarios in which, even if you stop breastfeeding, that you can find that you're still producing around the same amount of milk that you would be if you were feeding, or is it pretty much across the board that just doesn't happen?
If you stop putting your baby to the breast, you stop pumping, you're not doing anything, your milk's going to start to stop producing rapidly. It's going to take some time for it to completely stop. Sometimes there's situations where mom wants to start making milk again, so it is possible to relactate and start that process over. You might not be able to get a full milk supply. It's going to vary. And also in adoptive situations, women are able to lactate. So even if you don't give birth, you can induce lactation.
Wow. Okay.
That's obviously a more difficult process, but it is possible.
Very interesting. Okay. Now, how can someone maximize their milk production right from the get-go?
Right. What goes on those first couple of days is really important for setting yourself up for a long-term milk supply. Just right after your baby's born, if it's possible, you want to get your baby skin to skin. And that time right after your baby's born, we call it the golden hour. Ideally, your baby's born, they're put on your chest, and they're able to hang out there until they have their first breastfeed. Okay. Obviously, we know that there's something going on at the birth with your health or your baby's health, then you have to be separated. But as soon as you can be with your baby again, just start holding them. That environment is really important. They don't have good vision when they're born, but they can smell you. They can feel your heartbeat. Their breathing's more stable. Their heart rate's more stable when they're on your chest. And that is giving you that oxytocin release. So oxytocin is called the love hormone, and it's for milk production and bonding for you and your baby. It used to be they take the baby to the nursery and you get to sleep or whatever. But now it's more keeping the baby with you. And that allows you to recognize when your baby's hungry. They're giving hunger cues, just feeding them as much on demand those first couple weeks is really important for your milk production. If your baby's having any difficulty breastfeeding or you have to be separated from your baby, then you want to start pumping or hand expressing as soon as possible.
In the early days, you're feeding your baby very often.
Yes. Babies eat 8 to 12 times a day. 8 is the absolute minimum. And it can seem like that's all you do, and pretty much it is.
Right.
But all of that, it's driving your milk supply at that time.
And how long would you expect that to last for, that you'd be feeding every, give or take 2 hours, at least 8 times a day? For how long about would that be for?
In the early days, especially the first month, you shouldn't really expect your baby to sleep longer than 4 hours. 4 to 5 hours. Feeding at night, that's totally normal. And them needing those calories at night is normal. Your milk supply is highest usually between 3 and 5 a.m. That's when your prolactin is spiking, your hormones. And that's when your milk supply is greatest. So that becomes really important in terms of keeping your supply long-term, those night feeding. As baby gets older, they might start consolidating feedings more, taking more at each feeding, so they're able to go longer.
I was also wondering, considering that your baby would be feeding very often, those are, from what I'm understanding, are smaller intervals of feeding rather than later on, as they're more developed, they're going to be doing larger amounts of feeding. I think it would be helpful if you described what foremilk and hindmilk is, and then also, would your baby getting the right amount of foremilk and hindmilk at the early stages, considering that they're maybe doing smaller feedings versus later on when they're doing a larger supply? Does that really make a difference?
Our body makes one kind of milk. Foremilk and hindmilk really means the milk at the beginning of the feed versus the end of the feed. So what happens if the breasts are full, it's been 2 hours, then the fat globules in the milk kind of get stuck in the ducts. That first milk that's coming out has less fat in it. And as the baby starts to drain the breast, so that hind milk can be fattier. Now, there's not a point in the feed, 5 minutes. It's like a gradual, what research tells us is that it's more about the volume your baby takes in a day. So your concern should be, is my baby taking in enough milk total for that day? No matter the interval your baby's eating at or frequency, the fat content averages out to be kind of the same over a 24-hour period.
Okay.
So some feeds, it might be less fat. You might have more of that foremilk. And then some feeds might be fattier. The fat content varies depending on the time of day too. I always say, don't worry so much about that foremilk, hindmilk, or getting caught up on that. First, we're going to look at how much is your baby taking total over the day, the course of the day. But it is definitely an interesting question and something that a lot of people are worried about.
Great. Well, I'm glad that we addressed that. Is there anything else that you wanted to address when it comes to maximizing milk production?
Just some other things to talk about. It's super stressful after you have a baby and you're sleep deprived. You're worried about, is my baby getting enough to eat? Am I doing this right? So all that stress can play a role too in production, because those cortisol levels are the opposite of that oxytocin. If you're super stressed or anxious, or if it's not going well and you're in pain, that can all inhibit milk letting down. It can play a role in your milk production. And I see this a lot of times too, very traumatic birth, or their baby had to be taken to the NICU or something like that. All those things can play a role in your ability to make milk. Watching out for your stress levels, making sure people are helping you. Your job is just to take care of your baby, not doing the laundry and going grocery shopping and feeding everybody else. And if you have other children, having family and friends there, especially those first couple weeks, and then getting sleep when you can, because sleep deprivation can really trigger anxiety and depression. Right. So if you have a history of anxiety and depression, just watching out for that and keeping an eye on how your mood is. The baby blues are one thing. This is going on for days and weeks where you do not feel like yourself, then you should reach out for mental health purposes too. Right. The statistic is 1 in 7 have postpartum depression. And a lot of times it can go hand in hand with your milk production, because that is compounding your anxiety and stress.
Right. And here in Toronto, at least, there's actually a really good line, and you can look it up. There's a phone line that you can call called the Cope line. And if you're ever struggling with anything at all, you can call this phone line 24 hours a day, and there's someone there that can talk to you. I'm imagining for a new mom, especially if it's your first child, and you just need someone to talk to in a specific moment, and it would just help ease your mind. This service is great. There's no shame in it. It is very helpful. It's there to be able to calm the nerves and get us into the right headspace, at least for the moment. It's not a cure-all for the rest of the time or anything like that, but at least it helps for the moment. Use it. Again, it's called the Cope line.
The place I always send postpartum women to is PSI. and it's international. So I think there probably is a chapter in Canada, but they have a hotline too, like you were saying, and they help connect you with mental health support in your area that have special training with postpartum. They specifically can recognize these perinatal mood disorders.
Great, thank you.
I'll just mention, if your baby's older and you're noticing a drop in supply, and this can sometimes happen if you are going back to work, your stress is increasing, you're pumping at work when you're away from your baby, maybe your baby's not nursing as much when you're home. It's just as important 3 or 4 months later to still be removing the milk on a regular basis. So you don't want to go 6 or 7 hours without doing that. It continues to be important. Some will be able to store more milk in their breasts at a time, so they can go longer between expressing. But really, setting yourself up in the beginning is going to be beneficial to you months and months later.
We should talk about the different signs your baby is getting enough milk and how these signs can differ potentially depending on the age that your child is.
So in the beginning, first couple weeks and even 2-3 months, most babies are still going to be eating 8 to 12 times a day. Some will start consolidating feeds sooner, but really in that first 6 weeks, they should be eating every 2 to 3 hours. Usually I don't see a lot of babies sleeping through the night at that point. And that can cause a problem for weight gain and also for your milk. Noticing how your baby after they eat, are they content? Are they half asleep and satiated looking, or are they still putting their hands in their mouth and sad or fussy? Are they falling asleep when you're trying to feed them? That could be a sign too that something's off, that they don't have enough energy. And then the first couple months, your baby is gaining 5 to 7 ounces a week. So that's about an ounce a day. They're really growing rapidly. Going to the pediatrician for their regular appointments to make sure that they're staying on track will give you a really good indication that they're getting enough milk. And then when they're breastfeeding, can you hear them swallowing? Do you see motion in their throat? And do you hear that little sound when they're swallowing? And then the biggest thing, especially in the beginning, is their wet and dirty diapers. In the beginning, it's important to track their diapers. What goes in has to come out. How many wet diapers do they have a day and how many dirty diapers? The color and the quantity. That's going to give us a lot of information. For the first 4 days, we kind of look for 1 wet and 1 dirty per day of life. So the first day, we would expect 1 pee and 1 poop. Second day, 2, and so on. And then once we get to the 4th day, 5 to 6 wet diapers a day, and then 4 to 6 poops a day.
Pretty significant amount.
Yeah. Some babies will go down. They're not pooping 6 times a day. Right. Some might go to 2 or 3 a day, but that's really closer to 2 months.
If you're seeing this serious sign of your baby not peeing, what would you suggest doing and how quickly should you react?
If you see any red or pinkish color, that could be uric acid crystals. So that's a sign of dehydration.
Right. If it's dark urine, that's not a good sign.
Right. It should be pale yellow. It should not smell. If your baby hasn't peed, if it's a really young baby and they haven't gone pee in 8 to 12 hours, that is serious. And I would immediately call your pediatrician. If it's after hours, then you want to go to the emergency room or urgent care. As soon as you become concerned, I would call your doctor.
You can never call too much.
That's why they're there, and that's why they expect you to call.
And don't feel like a burden.
Yeah.
Okay. Was there anything else that we missed about these different signs that you should look out for? And are there specific signs to do with age that we haven't touched upon?
If your baby's ever acting lethargic or they won't wake up to eat, I would call your pediatrician at that point too. If they're too sleepy to eat, then might not have the energy or they're sick or something's going on.
When in doubt, call your pediatrician.
Yes.
Okay. Now, what can we do if we think our baby isn't getting enough milk, maybe during a feeding, or they're not feeding as much as we would prefer them to?
If you're breastfeeding, then reach out to a lactation consultant or somebody specific in lactation. They can help you pinpoint what's going on. Like if you see me in person or any lactation consultant, we will do a weighted feed. So we'd have you breastfeed your baby and we'd weigh them before and after, and we can see exactly how much they take.
Oh, really?
And that,
what would the difference be, like a before and after? How much of a difference could we expect?
the scale that we use is really accurate. It's like in a medical office, and it's accurate to 2 grams. Like we'll weigh your baby, and your baby started at 8 pounds, 5 ounces. They had a great feed, so now they're 8 pounds, 7 ounces, and we know they took 2 ounces. We're also watching them feed too and see if there's any issues. If the latch isn't optimal or mom's in pain, then they might not be eating well. those can be signs too that they're not getting enough milk or that it's difficult for them to get what they need.
That's great. And I would imagine, but you know, like these really small details that only somebody of your specialty would be able to have an eye for.
Right.
Yeah.
So if you're just breastfeeding, you could start adding pumping in. I would always suggest getting help, but like if you're waiting on your appointment in 2 days, you can start pumping or hand expressing milk and then giving that to your baby in a bottle or syringe, depending on what age they're at. You can start to do that to give them some extra milk. And that'll also kind of tell you what's going on with your milk supply too. Your milk supply and your baby getting enough milk are obviously tied in together. Usually if your baby's not getting enough milk, something's going on with your supply or something's going on with their ability to remove it. And if that's the case, then it's going to start affecting your supply. So if your baby's not taking everything they need for the day, then your body's going to stop making that much milk. And then we have to figure out, is it the low milk supply that's the issue? What came first?
So what can you do if you think you aren't making enough milk, besides maybe, going to your lactation specialist, besides trying to make sure that if your baby's not feeding, that you're still pumping so you can keep the production going? What else do you
go back to the basics? Make sure your baby's latching well. See how frequently your baby's eating and just feeding your baby. Any stimulation to your breast is going to tell your body to make more milk. So we want to remove as much milk as possible. Moms that are not making enough milk or concerned about their supply oftentimes start pumping, which can be tiring. We call it triple feeding. So if you're breastfeeding, then pumping, and then feeding that milk to your baby, a lot of work. It's not sustainable long-term, and it's not really going to help you figure out what's really going on. But you always want to get help then to figure out the root cause. And we had started to talk about this before. There's different reasons you can have low milk supply. It could be if the baby's not latching well, if the baby has a tongue tie, if the baby was in the NICU and you weren't able to really be with them and get breastfeeding off to a good start, or you had complications afterwards and you weren't able to start pumping for 2 days. All those things can lead to a lower milk supply. But then there's also the other things like medical conditions. A lot of women with PCOS, diabetes, a history of breast surgery, or being on certain medication. And another thing that happens frequently, thyroid issues, and all of a sudden after you have your baby, right? And a lot of times we find moms, they might have low milk supply. Your medical history can also play in terms of figuring out what's going on with your supply. It can be tricky to kind of dig in and figure out what the root cause is. And that's where like finding somebody that really understands this is key. When in doubt, get help. Don't wait.
Yeah. Okay, well, thank you so much, Nicole. Very informative as always.
Thank you.
Thank you for joining this Inventive Minds Child, Youth, and Family Support Center workshop. Do visit www.inventivekids.com, kids with a Z.com, to learn more about the many other workshops available coming up soon. You can connect with Inventive Minds via email at inventivekids, again with a Z, at gmail.com for any parenting challenges so their professional team can connect with you. Check out a replay of this and many of our other podcasts by searching Inventive Kids on YouTube and the Parent Toolbox on Spotify. And join the Parent Toolbox Facebook community group today by searching the Parent Toolbox on Facebook. And we look forward to seeing you all again very, very soon. Thank you, Nicole. That was great. That was so much fun.
Thank you.